all our Herald TV viewers, a warm welcome. You are about to watch our special program, Health and Happiness. Both are interrelated. If one is not healthy, has some health problems, you can never be happy and it becomes a problem for life. Today there is a proliferation of diseases. Cancer is rising, diabetes, heart attacks, sudden deaths, cardiac arrest, and so on and so forth. And people are wondering whether there is any methodology to prevent all these and many other problems. Today we have diagnostic tests, 11 or 15 or 20 different types of tests. But the idea of these tests, which are very important, is to avoid or shorten hospitalization, reduce medicine usage, and also necessary for specific disease treatment. Diagnostic tests are a true game changer. It diagnoses the early signs of any problems of the illness and prescribes effective treatment and help you avoid long-term complications. So you need to go to these diagnostic test centers. There are different types of this type of centers, and these are, according to the modern medicine, are very, very important. We have one reputed laboratory here in Panjim, and I think well known all over the state and even outside the state, and reputed lab with cutting edge technology. It is headed by a pathologist. She graduated from Mumbai. She was studying there. Then she came to Goa, was there in the Goa Medical College, was in the teaching faculty, and later on thought that she could offer greater services in preventive medicine. Originally from Raya, and she came back to Goa because of her marriage to another doctor, a well-known doctor who is still there, and it's our privilege to welcome the one and only pathologist that we have, and that's none other than Dr. Sushila Sequeira Ifonseca. Dr. Sushila, welcome.
Thank you very much.
You have all the facilities in your laboratory. In the earlier days, I remember in Portuguese days, we never had so many laboratories. Of course, there was no such a proliferation of so many problems and the diseases. But today there are very good specialized laboratories, and you had one of them. What exactly is the role of your laboratory? Because mostly it's your blood testing and the other things. If you can share with us, it's open now to you.
In our laboratory, we do the basic tests that are required in hematology, in histopathology, in bacteriology, in biochemistry, and cytopathology. Of these, hematology is the one that that really is the one that is very commonly asked for, requested for, and which should be done more often than it is really being done. In hematology, the branch which we call hematology deals with blood cells. So we examine the cells which are the red blood cells, the white blood cells, and the platelets. Of this, most people know about hemoglobin. So the red blood cells carry the hemoglobin. When we estimate the hemoglobin, we know whether this person is fit, or if it is lower than the average, then we decide, yeah, there must be some reason where further investigation should be done. In the same way, the white blood cells also give us an indication if there is an infection, or if basically it gives you an infection picture, but it may be a bacterial infection or a viral infection depending on the WBC counts. You can get eosinophilia when there's an allergy or when there are worms in the patient. And the platelets also give us an idea of the condition of the patient. For example, in dengue, platelets decrease. So then we decide, yeah, this is a more serious case than a simple case where the platelets have not decreased. So this is the basic tests that we do. We call them complete blood counts. Besides hematology, if we go to the next, the biochemistry. Biochemistry is very important, especially because we do, that is the liquid part of the blood. You see, the blood has got two parts. One are the cells, the other one is the liquid part, which is the plasma and the serum. The serum is where we can see the sugars, we can see the cholesterol, the lipid profile, which we call the cholesterol, the triglycerides, the different fractions of the good cholesterol, the bad cholesterol. When there are other parameters, we can study the liver function tests, we can do the tests for the kidneys. So all in all, the hematology and biochemistry comprise the bulk of the work in a medical lab. But in a medical lab like ours, we also do the body fluids, the commonest being the urine and stools, then and feces. Then there is the bacteriology, where we take a sample, maybe of blood, maybe of urine, maybe of stool, maybe a throat swab, and we try and grow the bacteria, from which we decide, yeah, these are good bacteria or bad bacteria, and then we try and find out which antibiotics should be recommended or would help this patient. Then the doctor is guided on which antibiotic would work on this patient. Then besides that, there are the other type of tests that we can do. First of all, when we are dealing with blood, we could do the blood grouping, which I think is important for even for identity, which they are using in the schools now. Then besides the blood grouping, if a patient is for operation, the doctor automatically asks for certain contagious diseases tests. For example, for hepatitis B, for hepatitis C, for VDRL, for HIV. So those tests are also done in the blood. Then the body fluids, as I mentioned, the urine and stools. These are easy samples. The tests are cheap if you're looking at the price cost, and they are easy to get the reports fast. In the urine, we see infection. In the urine, we can make out if there is jaundice or suspect jaundice, because the color becomes dark. In the urine, we can find out red blood cells, and we can see crystals, so we can decide, yeah, there may be a stone in the kidney. From the stools, we can see, yeah, the person is passing blood in the stools. There's a special test for blood in the stool, besides seeing the red color of the blood. Then besides that, you can see if there are worms or if there are one-celled organisms, amoeba, and the related organisms like that. So it is easy for the clinician to treat. Besides that, there are the other tests that I've told you, bacteriology. We can do cytopathology, where we put cells on a slide and study those cells, and from those cells we can tell, yes, the patient has got first infection. Then we can tell, yeah, they are changing, so we must look out for cancer, or we can say they have changed and, yeah, the patient has got cancer, or there is a greater possibility of cancer. And then we also do histopathology, where we get biopsy samples from the surgeons who, when they operate, they remove a part which they find suspicious. We process that, and from that we tell, yeah, it is benign or it is malignant, and if possible, what type of malignancy. So all in all, our lab tries to cover most of the branches of pathology.
Yeah. Now, you talked about several tests that can be done in a laboratory. You talked about complete blood count. Now, for complete blood count, you don't need to feel that you are not well or you are well, but would it be advisable that you do it on a regular basis?
For complete blood count itself, you don't need to do it on a regular basis unless the hemoglobin. The hemoglobin is the one that should be done on a regular basis. You don't have to be unwell for that. And I preferably prefer to have it done regularly for children, you see, growing girls especially when they start their menstruation. their hemoglobin drops, and they don't think about it because they are so bothered about the pain they get. Nobody is thinking about, yeah, has the hemoglobin dropped too much? Is she getting the adequate food supplements or eating the correct foods to regrow her red blood cells? The same way, the complete blood counts are not so important, but yes, if a person has a tendency to allergies where the eosinophils go up, that is one of the type of blood white blood cells. So in that case, maybe you should do test more frequently.
Yeah, and also they talk about diabetes now. Now they have been talking of course, an older test it was there, but not being done regularly. The HbA1c, because normally people when they go for these camps and all that, they talk about have you been fasting, and then if they found elevated, then they will do the postprandial. Now, then you talk about the cholesterol and all that. Wouldn't it be advisable to do this test on a somewhat regular basis?
Definitely. I personally feel that everyone above the age of 35 should do a test for blood sugars, for lipid profile, one test for the kidneys, one test for the liver. Should do the test maybe between 35 and 40 or 45 once a year. But thereafter, after 45, they should do it every 6 months.
Regularly.
Regularly.
Yeah.
Because there are two ways. One is, you see, when you are active in school and college, you tend to run and burn up your calories faster. Then as you get a sedentary job, you're sitting at your table, you don't get enough exercise, you take a scooter, a bike, or you take a car, and you don't get enough exercise, you don't burn up your calories. And of course, as you have more money to jingle in your pocket, you have a better, what we call a better lifestyle. You eat more, you drink more, and you tax your body more. So from this point of view, yes, definitely you should have a regular checkup after the age of 35, blood checkup after the age of 35.
And what age would you advise initially? Some say 20, 25, because normally at 20 nobody does any test.
Nobody does tests. I would say follow especially the family history. You have a family history of diabetes. Some people have both parents diabetic or even one parent. Then you should do the test earlier. Now, we are fortunate, many people when they go for jobs, now the companies ask for
the
that.
private companies. Yes.
Companies ask. So those people are fortunate because at least there they get one. But most people when they are young, they don't think of blood tests. They think it is only for the people who are ill. No, blood tests and even the other tests should be done once a year or once in so many years when you're young, below the age of 30. But after the age of 35, definitely every year you should have a checkup.
Yeah, and in Goa, all over India, I think all over the world, diabetes is on the rise.
Definitely it is on the rise. There are many theories why it is on the rise, but the fact is that one should look for diabetes. There is no shame in having diabetes. You see, there are people who don't like saying that they went to the doctor, so they hide it. They don't know the symptoms, so they don't know that, yeah, I should get a checkup. The symptoms for diabetes are very simple. You have the 3 Ps. You have polydipsia. You're feeling very thirsty. Polyuria. You go to the toilet frequently, more than you normally were doing before or what other people were doing, especially at night. So it disturbs your night sleep. Polyuria, and polyphagia. You feel like eating all the time. You say, oh, that is good, but you find excuses to eat in between meals and overeat.
But you shouldn't rely solely on this.
No, these are not.
Signs.
You should examine, test your blood regularly.
Well,
and for diabetes, you have to do the fasting and the postprandial as you spoke about. And if you can, the HbA1c, it is a little more costly, but it gives you an average of your 3 months.
But the cost should not come in the way
No,
of...
it should not come in the way of your health.
Yes.
And the HbA1c is a good regulator for 3 months. So it gives you an idea, yes, and you will see it regularly, that HbA1c over Christmas time and birthday time, it goes up. And then some people, you know, they binge and then they come after some time being good, eating less and drinking less, then they come for their blood test. But the HbA1c will tell you whether they have binged earlier, and you cannot hide.
The cost factor should not come
should not really
in the way of your good thought process.
Because you will spend more on medicines otherwise.
Yes. And also about the cholesterol today. There are more cases of people suffering from heart ailments, heart problems.
Yes, high blood pressure.
Yes.
That is all because, again, our lifestyle has changed. We have the total cholesterol, which is estimated, and then we have to estimate the high cholesterol and the low cholesterol, or what we call, the high density level cholesterol, HDL, and the low density level cholesterol. Of these, the low density level cholesterol is bad. So we want to keep it down, where the high density level cholesterol is good. It helps to remove the low density
And they also talk about the triglycerides now.
Triglycerides also is another fat. Separate from cholesterol, there is triglycerides, which also damages the blood vessels.
And besides this, there are some blood tests that you can do to identify, especially if you had a heart attack, whether you would be liable for more heart attacks, like they talk about the troponin test and
the troponin
CRP and all that.
The troponin test is more to tell you whether you had a heart attack in that period, 24-48 hours, whereas the CRP will only indicates that it is a C-reactive protein, which is produced when there is inflammation anyway. It could be in the heart, it could be now in COVID, we had a lot of CRP being done because they felt the blood vessels were inflamed or the
especially
lungs
during
were
the COVID time, I think the laboratories had a bigger role to play.
CRP was an indicator of the patient's progress, whether it was improving or because it was inflammation and you didn't know where the inflammation was. It could be in the blood vessels, it could be in the lungs, it could be anywhere. So that gave an indication to your clinician that there is inflammation.
But even a normal person could resort to this test.
Yes.
Just for their welfare.
For their welfare.
Yeah.
But CRP is more when you really don't know is the patient got a problem, inflammatory process.
Yeah, because mostly heart attacks are due to inflammatory.
Yes, mostly heart attacks would be due to blockage of the blood vessels. The blockage occurs when your cholesterols are high. Mainly is when your cholesterols and triglycerides are high. And once the blockage occurs, the CRP will go up because there's inflammation. You see, because the deposits of the LDL cholesterol and of the triglycerides irritate the lining of the blood vessel. That irritation is what we call inflammation. That inflammation results in that CRP being produced.
So that means this test can be done by any person on a regular basis.
Anyone can request for the test.
But then is it lack of awareness amongst the people?
Yes, it is lack of awareness. It's lack of awareness that there is something like HDL cholesterol and LDL cholesterol, a good and a bad type of cholesterol. There is a lack of awareness of triglycerides also. And I must tell you that high triglycerides is very common in diabetics because it's not only a fat, but its breakdown and its production is interrelated with the glucose. So triglycerides is very important, especially in diabetics. And I think it is really that people don't realize that prevention, that diseases, heart disease or any disease as far as these metabolites, these cholesterol, blood sugar, diabetes can be prevented if they take earlier precautions. That's why I suggest that at the age of 35, you start doing it early. So you know what type of person you are, what type of body you have. And automatically you start looking at those parameters and taking care of those.
So if people are aware, I am sure that they wouldn't mind looking at the cost factor rather than to say that...
it becomes a discipline, it becomes a habit that I do my blood sugar wherever you are doing it, wherever you have faith in it. You're doing your blood sugar, you're doing your lipid profile regularly. And I would also suggest that you do one test for the kidney and one test for the liver. Because sometimes you're taking medication which affects these organs. Or also when you have high blood pressure, the kidney, for example, gets affected. So this should be a yearly habit. I do have patients who do this. There's somebody who does it every year on his birthday.
Oh, that's
Yeah,
nice.
so
Yeah.
he remembers that he has to do his checkup
Only thing is you have to come
on a fasting stomach and then celebrate
And
afterwards.
fasting, what exactly is the number of hours that?
Fasting is recommended, if you go by the textbook, 12 to 14 hours. 14 hours, I personally feel, is very difficult for a working person. So I say at least the minimum should be 10 hours. Then you really get an idea, because I feel that very few people stay hungry for more than 10 hours. So at least if you have 10 hours, then you know what is happening to you daily.
Yeah, and can you drink water during this?
Plain water you can
Plain
drink.
water
There is
is-
no
is-
problem
there
with
is no
plain
problem.
water.
Yes.
They even say you can have plain coffee without sugar, without milk. But if you want to avoid everything, have plain
So
water.
water would be ideal.
Ideal.
Yeah. And would you say that even youngsters, maybe because they say the heart is not fully developed until 15 or 18. So should this test also, especially if they are going for sports, do you think that this test would be advisable?
Maybe one screening would be advisable, especially if there's a family history of it. Like I was just telling, I'm going to tell you the story, but I can tell everyone.
Yes.
We met a gentleman who, young boy, must have been about 25. And he said to us, we were traveling, and he said to us, you know, I'm diabetic, I'm strong. He didn't say exactly diabetes. My sugar level is very high in 300, and they found it only after 1 month after started my job. So he was blaming the job. But we said, you must have been diabetic long ago. Thank the job, because they did your blood tests and they found that your sugar was high.
Yes.
So it is like that. The youngsters never think that they can be having some problem in their blood. So it is good that the family gets their child checked off and on, maybe when they have a problem, an illness, or even otherwise once a year, once in 2 years at least, till they leave school, they should at least know what type of the hemoglobin, as I told you, should be done. Then like this, you can do a blood sugar and a total cholesterol, especially if there's a family history of it. So automatically the child, as they grow up, they know that this should be avoided and that should be avoided.
Now in England, for example, if children are into sports, they are mandatory that you need to do this test. Without this, you cannot get into sports.
And it's a very good thing. And the child should be made aware. Not only that for sports, but even otherwise, the child should be made aware that these foods are not good, because I have high cholesterol, once it becomes a habit, the family only will spend less on the medication.
Yes.
And on illness.
Yeah. Earlier you were in the Goa Medical College.
Yeah.
You were in the teaching.
Yeah.
What made you to shift to this?
That is a very difficult question to answer. You see, I was a lecturer and I was very happy with my job. But there were many influences. One was that I felt, you know, when you're young, you have these ideas. I felt that I was out of the house the whole day, because I used to leave the house at 8 and come back for lunch for half an hour or 1 hour, then go back and come back at 5:30, and then you're too tired to really be dedicated to your children. And I had 2 little children, and I felt it wasn't fair to them. That was the prime reason why I gave up that job. And I think when you're young, you are enthusiastic, and I felt that I could do it. And I didn't really look at the monetary side of it. I looked at the satisfaction of my work. And that is the impulse, or that is the push that I got from myself, that energy that I got, that I could do a good job on my own. Then it was where to start the lab. In those days, Panjim was so quiet, and by 7 o'clock or by 6:30, it was dead in the city.
Yes.
My husband and I went around looking at places in the city, and then he decided, he said, you cannot be here after 7. And you never know when you have to, a doctor has to be there after 7, and a lady doctor alone. So he said, we'll take 1 room in the house. And I started with 1 room in the house. Now most of the house is involved in the laboratory.
So you converted your house. Now it's a full-fledged laboratory.
No, we still have a couple of rooms where we when we don't want to go to our other place, we stay.
Okay.
But we use a lot of the house for the laboratory.
Now, in those days, there were hardly any laboratories.
Yeah.
And later on, this new thought process of
Yes.
laboratories.
Yes.
And also, I don't think so there were so many tests available during
Correct.
those days.
Correct.
What is
Correct.
the scenario now?
Now, you see, things have changed so much. Like as you say, before everything was manual. Then I remember we got what we called a semi-automated machine. And I know there was a lot of buzz in the medical fraternity. Dr. Sushila's got a computerized machine. It was really a semi-automated machine. But interesting how I have seen from having to boil tubes to putting, you see the methods changed. It was first chemical, then it became enzymes. So enzymes, the result comes faster. Then you use that semi-automated. Now for many tests, it's fully automated. And reagents, initially we had to prepare our own reagents. You had to, you got the powders and then you had to weigh it on a, I had a monopan balance, which was supposed to be one of the latest balances. Then from the, you prepared your reagent and then you did your work. Now you get your reagents ready-made from companies that have come up. They give you the reagents, standardized everything. So life has become very much easier between the ready-made reagents and the fully computerized. But the catch is that you have to standardize properly. So I still say it depends on the person behind the machine.
So still you
need to be very, very careful, very attentive, and be able to reproduce your results to be sure that
So that means
okay.
quite a very vast topic.
Yeah, it's a vast area. We definitely have increased the number of tests we are doing.
Yes.
Number of tests means the variety of tests that we are doing. For example, now we used to do only fasting sugar and postprandial sugar. Now we've added HbA1c. Then in cholesterol, we used to do a total cholesterol and a triglycerides. Now we've added the HDL cholesterol and the LDL cholesterol. Then, like you mentioned, there is troponin. There is, for the heart attack, there is CPK-MB. There are many other enzymes.
So this is a vast.
Yes, it keeps on increasing as
and
time
I think
goes.
there is lots more that we need to talk and share with the people, so that it enhances their health. For today, I think we restrict at this point.
Yeah, I think I've talked a lot.
No, and I think we will need you for another session, because a lot of tests are also to be highlighted.
Okay.
Now, for example, for the thyroid, pap smear, and
Yes,
so on,
yes.
that you have been sharing
Yes,
with me
yes,
earlier.
yes.
So for today, let me express my gratitude. You have closed your laboratory. Of course, your personnel is still there, but you made it time for us, for the benefit of the people who will be watching, and that's also important. Dr. Sushila, thank you very much for being with us.
Thank you for having me.